I'm Armin Brott, and I'm here with John Bonhomme, who is with the National Black Men's Health Network and Men's Health Network, and he's talking at this conference. He's going to be talking about the overall importance of fathers and how they've been neglected a little bit, and want to welcome you. Thanks very much for joining us, John.
Thank you for having me. I have a rather interesting story. In Pulanesburg, South Africa, they took a group of mothers and their offspring and put them in a living environment. The juvenile males went on a killing spree. They had left the male adults behind. The male adults were added to that community and the killing stopped. It was a herd of elephants. The juvenile males were killing the endangered white rhinos, and they killed about 1/10 of the population. The basic issue is showing, the reason why I bring that up is because people use animal models to discredit the importance of fathers. I know one guy who, during a divorce, when he asked about shared custody with his wife, the judge told him, "Well, I never saw the calves follow the bull. They always follow the heifer. So you have no value." But there's a great deal of sociological importance and also health importance to including fathers in parenting.
Well, I'm sure the experiments with Harlow and the wire monkey, and he called one of them the mother, and he called the other one not the mother. And so you have this whole body of research that shows that mothers are important when he could have just called it a parent when the little monkeys were going over to the fuzzy model instead of the wire one. So it's similar. We just have left dads out of research and out of policy for pretty much ever.
Yes, we have, and it's been to a great detriment to society, but a new field is coming up that's showing that fathers are not only important sociologically. I mean, everybody hears the statistics about how children without fathers don't do as well in school. They're more likely to be drug addicted. They're more likely to have teenage pregnancies. They're more likely to fall into being offenders and things like that. We hear a lot about the sociological consequences, as there was in this community of elephants. There's sociological consequences to excluding adult males. But another aspect of it is actually the health of the father has much more importance to the health of the children than has been previously recognized. They have found that the father's exposures can affect the health of children, whether they get cancer, what type of diseases they may have, their disease profile in the future, because they used to believe that the only way that a male could impact the health of a child would be through gene mutation. A gene would have to mutate. We now know about epigenetics. Genes are inherited not only with their normal sequence, but in their state of regulation. So if a man is exposed to a substance that shuts down a gene that fights tumors, he may not get cancer, or he may, but his children might, or even his grandchildren, because the fact is that the gene regulation is inherited, even if the gene itself is unchanged. So what they're finding out is that men who have been exposed to certain chemicals are more likely to have daughters with breast cancer. Men who are exposed to certain chemicals, they did an experiment with mice. They took male mice and they exposed them to cocaine through inhalation. When they mated them with unexposed females, the pups had learning difficulties. They couldn't find their way through mazes, and actually the females were more severely affected than the male. The female pups were more affected than the male pups by the father's exposure. A woman tried an experiment where she gave female rats morphine, and the pups were born smaller than normal because of exposure to the drug. Then she gave male rats morphine without exposing the females, and the same consequence happened. And she was shocked by that. She thought it was an intrauterine environment type of thing, but actually it's a genetic thing. It's a epigenetic thing, actually, that the gene regulation is inherited. So the point is that what the father is exposed to, and men have a lot of hazardous work exposures, with like 93% of fatalities in the workplace, what we're exposing the fathers to can impact the health of the children in the future. Also, the father's age is much more important than was previously recognized. They used to believe that a mother's age would result in Down syndrome, and women were warned not to be too old when having children, that there were more health risks to the
Right, men with kids of older fathers are more likely to have bipolar disease and things like that, right?
Likely to have schizophrenia. They're more likely to be autistic. There are some diseases like dwarfism, achondroplastic dwarfism, are more likely, and also a rare but very tragic disease, progeria, where the child ages and it looks like an 80-year-old at age 13, is also associated with older fathers. But here's a really surprising thing. A group in Minneapolis, headed by Dr. Wen, looked at teenage fathers who were mated with 20-year-old plus mothers. and found that the offspring of the teenage fathers were more likely to be stillborn, more likely to have SIDS. They found that males younger than 20 and much older than 30 don't produce the same amount of healthy sperm as a man in his prime. So a man's reproductive life expectancy is longer than a woman's, sure, but the healthy reproductive life expectancy, while still somewhat longer than a woman, is not infinite. If you are a very elderly man and you have sex and impregnate a woman, there may be health consequences to the child as well. So the health exposures of the man are important to the child. The father is important to the child's sociological development, and the age of the father is much more important than was previously recognized.
So the talk that you're going to be talking about is at a conference about fatherhood and men's health. And one of the things I've always found interesting is that we talk about a lot about what you've just been talking about, the impact that fathers have on their children. There's also the other side of it, which is the impact that being a father has on the man himself, and that men who become fathers or who are expectant fathers are less likely to engage in risky behavior. They're less likely to do stupid things that land them in jail. I remember when I was an expectant father, I had this very clear moment. All of a sudden, yellow lights meant slow down and get ready to stop instead of floor it and see if you can get through the intersection. And it was, I got places to be. I can't do dumb things like this all the time. And that's the kind of thing that happens that makes men better people and more responsible adults.
Yeah. Maybe being an expectant father is a giant sign saying, grow up. And that's exactly what it's saying. So the point is that when you know that you have something that you have created, that you have an investment in, that's going to be your future, you're much more motivated to be a stable individual, than you are if you don't have any responsibilities to anybody. So yes, fatherhood benefits men as well. But the lack of attention to fatherhood is bringing down all of society, and children especially.
So why is it? We've been talking over the course of 20 years about a lot of these things, about the things that you mentioned about kids do better in school, they're less likely to become teen parents, less likely to become addicted. We know all this stuff. Why is it that we're still talking about the importance of fathers instead of just saying, okay, dads are important, let's just move forward and start instituting some programs? Why are still asking the question?
Part of it has been the economic system. When we were in an agricultural society, the home was the economic center, and the father was a very important figure in that home. When we had the Industrial Revolution and people found made it necessary to move the breadwinner, who was basically based on physical strength, out of the home, then the father had less connection with the family because of where he had to go to work. Then we had doctrines come in, like in the 1920s, the tender years doctrine, which was a very romantic notion that small children belonged with their mothers, but that became extended to teenagers who are not small children, anymore. So the point is that I would say that the economic changes in society had a tendency to remove the father from the home. And I also think that, very frankly, divorce is very lucrative for certain elements of the legal profession, and I really think that they tend to promote it rather than try to prevent it.
Sean Bonhomme with the National Men's Health Network and Men's Health Network, thank you very much for joining us.